that is dose calculation and dosage schedule in KAUAMARBHRITYA. So friends, welcome back to my YouTube channel, Medical Classes by Srinidhi Acharya. Don't forget to subscribe my channel and also give your valuable comments. As we know, dose calculation is very important in children, and dose calculation depends upon many factors, and it also should be decided according to the weight, age and surface area of the children as far as the contemporary medical science is concerned. Now, dose calculation in children compared to adult is very important because there is a difference in body anatomy, physiology and biochemical parameters in children and as well as adults. Consideration of the age and weight before administration of the medication or the procedure in a child is must, because overdosage and underdosage both leads to treatment failure. Judicious administration of the medicine is very, very important. And there are some limitation for the children, especially there is a limitation of maturity in physiological functions of the body like rate of absorption, metabolism, excretion, demand, tolerance and safety index of any drug in pediatric clinical practice. So we have to keep in mind about these important physiological limitations because of immaturity in children. So accordingly we have to adjust the dose also, because safety index will be very narrow in case of children. So dosage has to be decided by the criteria like body weight, then age, surface area and body mass index, etc. In the contemporary science, we will have all these criteria for the calculation of the ages, age-wise calculation of the dose. Now same when we talk in terms of KAUAMARBHRITYA. So what is told in Kashyapa Samhita is Nishkwatanam sa kalkanam churnanam sarpishas tataha ityukta vivida matra moolam chikisitam. So this is explained by Kashyapa Samhita in Kilasthana, third chapter. In the first sloka itself he says, treatment basically depends upon dose. So in this chapter, that is Beshajopakramaniya Adhyaya, he explains the dose of Kwata, Kalka and Churna. Hence, it is told that Matra plays a vital role in the treatment. So he says, Matra Moolam Chikisitam. Okay, so Matra Mula. Matra is a Mula of Chikisa. Therefore, selecting the proper dose or giving the medicine in a proper dose itself is one of the key factors for the success of the treatment. This has been mentioned by Kashyapa in the beginning itself. Now, Charaka says in Chikisasana, one important sloka, what he says, Dosha Dusha Malaschaiva Mahatam Vyadayaschaye Ta eva sarve balanam matrato alpataramataha Juradhyaha Vyadaya sarve mahatam ye puroditaha Baladehe apite tadvat vijnayam kushale sadaha. So this is mentioned by Madhavanidhana and first sloka is mentioned by Charaka Chikisa. Actually, the meaning is the body is constituted by basic elements like dosha, dusha and mala. This is even true in case of child and also adults. That means dosha, dusha, malas, there is no much differences in child and adults. According to Charaka, they exist in both children and as well as adults. The only difference is, this is even true in case of the child, but the major difference is the matra. That is, matra will be less in children compared to adults. You say dosha, dusha or mala, everything is less in children, and as a result, dose of the medicine is also less in children. So disorder which afflicts the adult body equally afflicts the child, but a wise or expert physician will always identify the changes in its presentation. Okay, ta eva sarve balanam matratu alpataramataha. So dosha, dusha and mala are also less in children. Okay, so hence we have to accordingly decide the dose, and dose will be also less in accordance with this, in accordance with the existing doshas. So in this context, actually the word matra refers to quantity. Word refers to quantity. Matra refers to quantity. All the basic elements and disorders afflicting the body are qualitatively same, but in both adults and child, but quantitatively less. That's the meaning. Less body mass, less bodily elements, less maturity leads to differences in the presentation and severity of the symptoms, doshas, etc. For example, jara. Disorders may be more severe in the child when compared to adult due to less maturity of the bodily doshas. Although same degree of jara is coming, 2 degree or 3 degree fever is coming, that may be more severe in case of children compared to adults because of immaturity of the body system. Dhatus also and limitations in the immune system. Example, presentation of the tuberculosis in child is entirely different from that of the adults. Okay, so that is also because of the change in their bodily physiological activities. Madhavanidhan also gives almost all the same opinion. Now, Shushruta says regarding dosage, Tatra masat kshirapayam. So, dosage of Shushruta basically divides the age classification to Kshira, Kshirada, Kshiranada, and Kshirada, Kshiranada, and Annada. So, he says that dosage for the Kshirapa at 1 month will be equal to the quantity which comes in between the 2 fingers. Okay, Anguli Parva Dvayara, Kshira Anguli Parva Grahana. Okay, so dosage for a Kshirapa in the 1 month of age is equal to quantity which comes in between the 2 fingers while pinching, and this should be given with the milk, probably 1 pinch. Whereas for Kshirana, he says the dosage should be almost all equal to kolasti matra quantity of the medicine should be given, and kalka will be the preferred form of administration. In the Kshira Pravastha, it should be given the milk, whereas when you come to Kshiranada, it should be given in the kalka form. Again, he says for the Annada, the dosage is that of the kola matra. The dosage of the medicine should be kola matra in any preferable form. Okay. Further, Shushruta explains an increase in the dose as the age advances. This is a dosage schedule given by Shushruta. Now, if you see the Yoga Ratnakara, a detailed explanation has been given. Pratame mase balasya deya beshajya raktikaha avalehi hatu kartavya madukshira sitagritehi ekaikam vardayet यावत् संवत्सरो भवेत् तत् ऊर्ध्वं मासवृद्धिः स्यात् यावत् षोडशवत्सरः ततः स्थिर भवेत् यावत् वर्षाणि सप्ततिः ततो बालकवन्मात्र ह्रासनीय शनैः शनैः चूर्णकल्क अवलेहानाम् इहं य मात्र प्रकीर्तितः कषायस् पुनः स्तेव विज्ञातव्य चतुर्गुणः क्षीरस्य शिशोर्देयम् औषधं क्षीरसर्पिषः दात्र्यास्तु केवलं देयं न क्षीरेण अपि सर्पिषः. So such a detailed explanation is given by Yoga Ratnakara. So what is the meaning is, first month for a neonate, the dose of the medicine is 1 rati in the avaleha form mixed with madhu, ghrita and kshira and sita. Whereas in the second month of the life, okay, that's in infancy, second month to 12 month, the dose should be increased by 1 rati every month. 1 month it is 1 rati. Up to 12 months, it has to be increased by 1 rati every month. So by that, at the end of the 1 year, it is 12 rati. So 1 year to 16 year, again he says the dose should be increased by 1 masha every year. So that at the end of 16th year, 16 masha is a dose. Now, he says the same dose should be continued till 70 years of the life. That is in the adult life. Okay. Now he says again after 70 years, gradually you have to decrease the dose. Okay, because as the age advances in the Vruddhavastha, again the weight comes down. So again, according to calculation of the weight, we have to correct the dosage also. So he says after 70 years, gradually decrease the dose because doshas are also coming down, dhatus are also coming down, body weight is also decreasing. So decrease the dose. And this dose will hold true for Churna, Kalka, Avaleha preparations. When you administer Churna, Kalka and any Avaleha preparation, this particular dosage schedule holds true. Again he says, while prescribing the Kashaya preparations, any of the Kashaya preparations, dose will be 4 times more than that of the above mentioned doses. Kashaya preparations. Churna, Kalka, Avaleha, the above dose is mentioned. And for the Kashaya preparation, it should be 4 times more than the given medicine, the given dose like Rati and Masha, etc. Now again Kashyapa Samhita in Kilastana, he again says, Apramata Sadacha Syad Beshajanam Prayojati He. औषधि नामरूपाभ्याम जानन्ति वनगोचरः अजपालश्च गोपश्च न तु कर्म गुणं विदुः. Again, in the administration of the medicine, he says, administration of the medicine in children should be planned very carefully after thorough analysis of its justified use. Even shepherds wandering in the forest can also name and identify the drug, even though they are not aware of its quality and function. Okay, by name, even the Ajapala or shepherds, etc. So they also know the drug. but they don't know exact its indication and its also gunadharmas. So only naming the drug is not sufficient. Instead, the practical experience of administration on the basis of guna and karma is very important. Hence, blind administration of the drug should not be should not be given in children. So this is a message given by Kashyapa. Now again, Kashyapa says, Shatake Shatadike va api kshirannada avishyate he. Again, Kashyapa Kilasthana Beshajapakraniya Adhyaya. He says that dose of the medicine should be gradually decreased after 16 years. The same has been told by Yogaratnakar also. Kashyapa says, when person reaches 100 years or more, again the dose of the medicine will be reduced to that of the kshirannada. That means when person reaches 100 years or even more than that, in that time, as we gradually decrease the dose as the old age starts, the dose of the medicine will reach to dose of kshirannada at the age of 100 years. So this explains the importance of dose in children in relation to weight of the baby or weight of the body. Okay, as the old age passes, the weight of the body, dosha, doshas, everything go on decreasing, and accordingly we have to decrease the dose of the medicine also. Now again Kashyapa says, Tasmat Agni Agnipradu Satmyam Deham Koshnam Vayobalham Prakritim Beshjam Evam Doshanam Udayam Yatam. That is, before fixing the dose to a children, one should consider the following important facts. So what he says, Agni, Rutu, Satmya, Deha, Koshta of the Deha Koshta, Vaya, that is age, strength, that is Bala, Prakriti, that is constitution, medicine, that is Aushadhi, and status of dosha prakopa, and status of dosha shamata, dosha shanti. So these factors has to be understood before administration of any medicine to child. Now, Kashyapa Samhita again says, Yata alpadehasya yad alpam tata annapana aushadim alpam vruddhya vimarshet bishag matrahi deha agni vaya pradana. So first he says matra moolam chikisitam. Similarly now he says another important thing, matrahi dehagni vaya pradana. Okay, so person who has got small body stature will have less amount of bodily doshas. So a wise physician should implicate food, liquid and medicine or aushadha accordingly in a small quantity, because matra mainly depends upon the digestive and metabolic capacity as for the age. Okay, that means the message is you have to use the medicine according to the Deha Agni and Vaya, because Matra hi Deha Agni Vaya Pradana. Okay, so when you administer the medicine according to the Agni Bala and also Deha Bala and according to the Vaya, then only it will give the results. Now Kashyapa again says, Vidanga Falamatrantu Jata Matrasya Dehinaha Beshijam Madhusarpibhyam Matiman Upakalpayet Vardhamanasituhu Shishor Mase Vivardayet Yatha Amalaka Matrantu Param Vidvan Na Vardayet. Similarly, Yogaratnakar also gives a similar opinion. Vidanga Falamatrantu Jata Matrasya Beshijam Ete Nima Pramanena Masi Pravardayet. So now this explains the dosage schedule during the infantile period. Okay, so starting dose for an early unit, that is Jata Matra, early unit, is 1 Vidanga Pramana, and it should be gradually increased in the successive months of the infancy. Okay, so maximum dose that you can give at the end of 1 year. Okay, Vardhamanasya Shishor Mase Vivardate. Okay, so maximum dose of a medicine that you can give at the end of 1 year should not exceed the Amalaki Matra. Okay, should not exceed the Amalaki Matra. Anupana advisor in this case is again Madhu and Grita. Okay, Beshijam Madhusarpibhyam. The same explanation is also given by Yoga Ratnakar. Now this is a big shloka given by Kashyapa, and this explains the dosage schedule for Sneha in neonate. When you give Taila or Dhritas in neonatal practice, the infantile practice, how much you can give. Okay, so this shloka gives a detailed explanation of same. I will cut down it. So in case of neonate, okay, the dose of the Sneha is Kolasti Matra. Okay, whereas in the 5th day, it is slightly more than Kolasti Matra. On the 11th and 12th day, it is Kolardha Matra. On the 1st month, it is Kola Matra. In the 2nd month, it is slightly more than Kola Matra. On the 3rd month again, it is 2 Kola Pramana, 2 Kola Pramana. In the 4th month, the dose is Shushka Amalaka Matra. and in the 5th or 6th month the dose for an infant is ardra amalaka matra. So this is again explained by Kashyapa. Especially this is holds true for the sneha, okay, any of the grita and taila preparations. Now Sharandara also gives a very beautiful dosage schedule. Balasya Pratame Masi Deya by Beshajaratika. His explanation is almost all similar to the Yoga Ratnakara's explanation which we have previously seen. So what he says, during the first month of the life, neonatal age, the dose is 1 rati, and during this age the medicine should be given with the Kshira, Kshaudra and Sita and Grita. Then actually same as that of Yoga Ratnakara. Gradually it should be increased by 1 rati, so that by the end of 12 month it is 12 rati. Then up to 16 years we increase by 1 masha, so that at the end of 16 years it is 16 masha. Then gradually decrease the dose up to, continue the same dose up to 70 years. Then gradually decrease the dose after 70 years. Okay, and while prescribing the Kashaya preparation, it is 4 times of the other above medicines. Almost all same explanation which is given by Yoga Ratnakara is also given by Sharanda. Now, this is explained by Kashyapa again in the Kilastana. Kshiranadasya balasya prayana ahara sankarat bhavanti aniyato vanhi paktoho anilatmaha. That means while administering the sneha substance in bala, Agni Bala should be considered for its all parameters. Okay, especially in Kshiranada, he says Kshiranadasya balasya, okay, Kshiranadasya balasya bhavanti aniyato vanhi. That is, especially in Kshiranada, Agni will be always unstable, aniyato. Okay? Hence, Sneha should be administered carefully. Whereas in Annada, Agni is more stable compared to Kshiranada, and Amalaki matra of Sneha can be given. So, in Kshirapa and Kshiranada, consideration for Agni Bala while administering the Sneha substance is very important. Administration of Sneha, in contrary to this, can lead to certain intestinal complications like diarrhea and as well as vomiting, diarrhea, loss of appetite, etc. Now, Kashyapa says, Deyam Sneha Chaturbhagam Beshajasya Yatamayam. Up to 8 months of life, infancy. Okay, 4 part of the Sneha, Aushadhi can be given with the Grita. After 8 months, he says medicine can be given with the mixing with the water. Okay, so after 8 months, you can give the medicine, that is Sneha, by mixing with the water. But before that, 4 parts of the Sneha Aushadhi should be given with the Grita. Now, dosage in KAUAMARBHRITYA again. So other references about the dosage is Muchuti va prakuncha va prasrutam va ajalyam aturasya pramanenaha sametavyam chikissatehe. That means, again he explains some of the dosage schedule. That is, during the treatment, as for the strength of the disease and the patient, medicine should be given in mushti, phala and as well as other pramanas. Okay, the Deepaniya Churna should be given as Agra Parvanguli Pramana Sama. Whereas dose of Kumbhasarpi is Padardahina, Padona and Ardha as per the Bala and Agni of the child. Jivaniya and Samshaniya Churnas are given double to the above dose. Whereas Vamana and Virechana Churnas are given half of the above. Okay? Above means Dvipaniya Churna and other Sarpi Churnas, Sarpi etc. Okay, Kashaya preparation should be given, especially Vamaka or Virechaka Aushadha should be given in 1 Prastata Pramana. Deepaniya and Samshaniya medicine should be given in 2 Prastata Pramana. Deepaniya Kalka should be given in 1 Karsha Pramana, and Jivani and Samshamaniya Kalka should be given in 2 Karsha Pramana. So these are some of the dosage schedules explained in Kashyap Samhita. Okay, so these are some of the very important dosage schedule which is given in KAUAMARBHRITYA, and this has to be kept in mind when you are administering the medicine to the children. So with this we conclude this session. Thank you very much. Don't forget to subscribe my channel and also give the valuable comments. Thank you very much.